Welcome back, everybody. Uncontrolled blood pressure is a major risk factor for heart attack, stroke, even kidney disease. Now, according to the American Heart Association, most people with high blood pressure don't have any symptoms and will go years without a diagnosis.
So we got Dr. Paul McMullan here from St. Thomas here to talk about the dangers a lot of us could be facing because you just don't know those numbers. Lots of people don't feel a symptom of high blood pressure. Welcome.
That's right. Most people are asymptomatic. Occasionally, when blood pressure gets really high, people might present with symptoms like headache or chest pain, but that's not the norm. Usually people don't feel it at all.
So let's talk about the numbers, because we know it's two numbers, one on top, one on bottom. What do each one of those mean?
The top number is the systolic blood pressure. The bottom number is the diastolic blood pressure. They're both important. And basically, when your heart squeezes, the pressure goes up, and a valve in your heart closes to prevent backflow, keeping the pressure in the blood vessels, in the circulation. And the top pressure is when the heart is squeezing, and the bottom pressure is when the heart's relaxing, getting ready for the next beat. So systolic, diastolic.
Got it.
You want them both low. But
lower's better.
Lower's better. Right. But the bottom one's always smaller.
True.
Bottom number.
Yeah.
True.
See how he's the doctor, but I go, the bottom number's smaller, right?
So when you have an uncontrolled or undiagnosed high blood pressure, what does that mean? Like, why is it so dangerous, and why do people really need to pay attention to these numbers?
Long-term, high blood pressure leads to things like heart attacks and strokes and kidney failure, and a lot of bad things that you can't undo.
Right.
And the good thing is it's very treatable, and most people getting on the correct medications can treat it and prevent those things.
So when you say long-term, that sort of gives that glimmer of hope. If you check your number and you see it's too high, maybe don't lose hope that there's ways to treat it. What are the best ways to treat it?
Yeah, so a blood pressure of 190 or 200 would probably be grounds to get immediate care. But generally speaking, when patients present to physicians' offices, it's a matter of trying a medication, see how they tolerate it, see how well it works, and having feedback over time regarding the numbers and how you change the medicines. And most people, if you look at statistics in the United States of America, most people who are treated for high blood pressure or hypertension require more than one medication.
So it's just getting in there, and also the diagnosis.
Bit of over time, figuring it out.
The American Heart Association, Advanced Financial, they've joined forces to now offer free blood pressure screenings to the Nashville community during February, which is Heart Month. So the free blood pressure screenings are being offered all around town.
Yeah, during the hours of 12 and 3 at these locations on your screen. Today's screening is going to be held at Advanced Financial's office. That's at 3713 Clarksville Highway. For a complete list, we've got it for you at Today in Nashville on our Facebook page. Thanks for pointing it out, getting us all a reminder that you need to be checked. The symptoms don't present themselves all the time.
My pleasure.
Absolutely.
Thank you so much.
Thanks for coming in.
Still to come. All right, Dr.